Welcome to the YouTube channel of Sibia Medical Centre. We are hearing a new term known as functional medicine. Functional medicine is basically, as the word functional indicates, it is dealing with the function. And it is because we want to pick up the disease at a very, very early stage. And we also want to know why a disease has taken place, because unless we know why it has taken place, the treatment cannot be very appropriate and very scientific. So to be scientific, we are having a new term, that is functional medicine. And today with us, we have an expert in functional medicine, and she is Dr. Preeti Nanda from Delhi. She has done her medical graduation from Medical College, Amritsar, and she has done her MBA from IIM Lucknow. She is also a member and she is a fellow of the A4M for functional medicine. And she is president of the Indian Academy of Functional Medicine. So today we will hear from her what this functional medicine is and how we can all make the best use of it. Welcome, Dr. Preeti Nanda.
Thank you.
Can you tell us something about this new word which is coming up worldwide, functional medicine? What exactly is it?
Perfect. So first, thank you for such a nice introduction. And functional medicine, if you will see the times when we used to go to medical college, most of the diseases we used to tackle were infectious diseases. But in the last 50 years, what has happened is most of the diseases are happening from within our body, right? And that's why we call lifestyle diseases. To heal these and to reverse these diseases, this term functional medicine came into play. In functional medicine, we strongly believe that your body is functioning at its optimum when it is in balance. What are the balances which we aim to achieve through this functional medicine? We actually balance your mitochondrial health. We balance your hormones. We look at your epigenetics. This is a very advanced science now, wherein we actually have the power to activate the right genes in your system so that you don't, suffer from diseases. We actually balance your structural postures because it's very important for a healthy, functional body. We work on the toxins in your body. Having toxins in the body actually are the starting trigger for you to have lifestyle diseases. In children who are autistic, in type 1 diabetics, in irritable bowel syndrome patients, जिसको कि in medicine we call that psychosomatic है, nothing can be done about it. Cardiac diseases, diabetic patients, we have found a lot of aluminum, cadmium, mercury in their blood and in their tissues, and we try to remove them, and that's how we actually reverse these diseases.
Thank you for explaining functional medicine in such a nice way. We are either pushed into a thing or we are pulled towards something. What exactly made you get into functional medicine? Were you pushed into it or were you attracted to it? What exactly made you? Because you have been taught modern medicine. Then you, after doing MBA, you are expert in managing also. So what made you get into functional medicine?
So Dr. Sibia, generally in functional medicine community, we have this term that you really have to be hurt yourself to get into functional medicine. I think that's what happened with me. I was leading a very successful life, but I was a diabetic, I was hypothyroid, I was 89 kgs. I was constipated almost always. The biggest problem while I was traveling was how would I clear my bowel and how would I feel healthy? Brain fog, migraine headaches, 3 days in a week I used to have migraines. And despite that, I was working in my corporate life, heading VLCC, heading publishing in Springer and doing all that stuff. And one of my travels, I was in US and I met a radiologist who actually had to quit radiology practice because she was allergic to the dye which radiologists use. And I think, as luck would have it, I happened to ask her, why did you quit your job and how did you come into this? And she introduced this functional medicine to me. And you know what she said? And I think that line pulled me into functional medicine. And I quit my job and came into this line. She said, Dr. Preeti, in the coming days, 80% of us, if not more, would need this type of medicine for us to become successful doctors and for human beings to live healthy. And I think that's what pulled me into this, and for last 6 years now, I'm doing this. And the type of miracles I see happening every day. Like Dr. Sibia, you would vouch for it because you are doing functional cardiology in a way, if I have to say that. And the miracles you do with your patients and you see every day, it's so heartwarming, right? And that's what we see every day, and I think it keeps me getting deeper and deeper into this science, and I am exploring it more and more.
Good. One thing which I pick up from you, and I also had the same experience, when someone says that you cannot be treated, someone says we do not know what treatment to give to you, it need not mean that there is no treatment. It simply means that I do not know how to treat you. So if such a situation comes to any of you, meet Dr. Preeti Nanda, maybe she has an answer for you. When a patient comes to you, how exactly do you approach a patient?
So we go from the cause. We try to find out how was the child delivered, in what environment the child was living, because basically we have 3 pillars to functional medicine. Genetics, very important, lifestyle and environment. So we start from genetics. We rule out all histories, family history, what was there, where was the child born, were there any other diseases there. Then we come to the environment. We check which area, was it a very polluted area. For example, even in Delhi, if I see people who come from Patparganj or East Delhi to me, they generally have high levels of cadmium. And so it becomes very important for me where they are living, what type of food they are eating, how they are cooking, and then comes their lifestyle. All of these together we find the cause, and once the cause is found, I generally believe that for me, the type of patients I treat, I believe in God, and I'm sure all of us believe in God in some way, and God's wish we all know is for us to be happy and healthy. And for me, God means gut, obesity and diabetes. So I combine these things and then work on this. So I start from the gut health. In allopathy or from the Indian tradition, we all know, our ancestors used to tell us, if you can eat and digest any food, so desi ghee becomes a part of the diet for diabetics from the very first minute they meet me. D is diet then. Now diet is very important, and Dr. Sibia, there are a lot of myths around it. One simple thing which you need to remember is, every carbohydrate you eat and every protein you eat gets converted into glucose. Fat you eat gets converted into ketones. Human body was a hybrid car. Please note, was a hybrid car. But we have made it into a monocar. Why? Because we stopped eating fats at all. And whenever we are eating fats, we are getting them for processed foods, which is trans fat, which is equal to cancer. And then we ask ourselves, why are we falling sick? Why am I diabetic? Why is everybody becoming PCOD? Because our eating has completely changed. Our ancestors were 110% right. Desi ghee is amazing, but make it at home. Don't buy it from the market, make it at home. You can get white butter from the market, but make your ghee at home. And eat desi ghee. Eat desi ghee, it is very, very important. Second is, so having fats is important. Second, people think sugar bilkul nahi khani hai. Diabetics come and what they say is, I have stopped eating sugar. So I ask them, have you stopped eating all carbohydrates and proteins? No. What is the connection? All carbohydrates and proteins are getting converted into sugar. So 2 spoons, small spoons of sugar for females and 5 for men are okay. But the balancing, your plate has to be balanced. That is very, very important. And S is double S, and it's the most critical part of the whole diabetes management thing, which includes stress and sleep. One night, if you don't sleep properly, you sleep at 1, 2 and get up in the morning at 9, 10. 70% of people can get insulin resistance in that one night. Look at yourself and look at what you are doing. And then of course, stress. Stress is not a situation. Stress is your body's ability to handle that situation. So my thing for all diabetics is know what is your situation and accordingly work on your body to make it strong. And then with this, once this is there, if this is not there, nothing can be done, Dr. Sibia. But if this is there, then I move forward, and after putting this in place, we work on the mitochondrial health. We work on hormone imbalance, because there is this triad. Insulin and cortisol are twin sisters. Your stress hormone and insulin hormone. Both have to be in balance. If one is wrong, the second will be wrong. Your thyroid and your sex hormones. This triad then we balance. Then we work on the toxins. And majority number of cases, they reverse their diabetes and then never become diabetic again. I am a living example of that. My HbA1c used to be anywhere between 6.4 to 6.8. Now it is never more than 5.2. Never. I eat everything. Dr. Sibia has been treating me with, a lot of yummy food, but my sugar levels stay normal within range. Why? Because I followed the Bent's approach. Plus, I balanced all the core imbalances in my body, and that's how, for 6 years now, I'm not a diabetic, and I hope I never become a diabetic again.
That's wonderful. As you have just learned, science is good, but alone science can be a big blunder. We must blend science with wisdom. In the pursuit of science, let us not forget that science is just decades of knowledge, whereas wisdom is centuries of wisdom, centuries of experience. So let's always blend science with wisdom. Coming to the next point, I suppose most of it is going to be the same as controlling diabetes. How about obesity?
Obesity is a very, very beautiful puzzle to solve. Unless I know why this person is obese, I will never put a person on a diet. Right? Now, for me to know whether the person is obese or not, why it is there, I will do heavy metal testing. I will check hormones. I will take their lifestyle history. I will check how the cooking is happening, who is cooking, how are they eating, where are they eating, and then I will start working on obesity. And once I know what is the cause, Dr. Sibia, it's like this. But finding the cause can take me days to sometimes months also. I keep doing testing, I keep finding, no, everything is in balance, something else is there. Because remember, 40% of obese people will have very perfect blood test markers. Right? And secondly, Dr. Sibia, second very confusing thing around us is, we don't know whether insulin resistance came first or obesity came first. Now, when I work with diabetics, in some people, I am not able to help them lose even 3 kgs till their sugar levels become normal. And in others, I am not able to reduce their sugar levels till they lose weight. So everybody is very personalized. Please look into what is the cause of your problem, and then solution is just a click away.
Good. Very well put up. We are hearing a lot of about gut health, and I think it is it's a very confusing word for most of the professionals. Just can you throw a small light on gut health?
Perfect. So gut is your intuition, right? Whenever we go for a difficult meeting, what happens? पेट में कुछ होता है ना? कुछ होता है. This gut, from our mouth, from the lips, to the whole system, the food pipe, the stomach, the liver, the pancreas, the small intestine, the large intestine, the rectum, and then the anus, from where we poop every morning. This whole system is the gut. The way I look at gut is, this is what made me from that little baby to this beautiful lady, right? This is gut, and this is the power of gut. And as Dr. Sibia, you rightly said, we cannot see this gut, and that's why we don't know a lot about gut. But this is at the core of all of your health. Your dyslipidemia, your diabetes, your migraines, most of your diseases come from here. And it is very amazing. So if I have to tell you in short why you should look at your gut health is, have you ever attended a wedding, or have you ever done a wedding in your family? I'm sure the answer is yes. Dr. Sibia attended one just yesterday evening, right? During the wedding, do you have one menu there, only one thing in the food list? No. Why? Because different people come and they have different taste buds. And we have to keep everybody happy. Similarly, your gut has 1 trillion bacteria, virus, parasites. They are all your baratis. And that's the way we have to look at them. And that's the reason the food we eat, the variety in the food we eat, the way we eat food becomes very, very relevant. And that's the reason that rainbow food meditation was very important. It was taught to us by our ancestors. There was a simple practice of praying before eating. Why? So that you can add prana to the food and you can improve your digestion and you can feed this bacteria better, right? This rainbow food has been very, very old concept. Why? Different colors of foods have different nutrients, different values. And these different bharatis in our stomach or gut, they have different taste buds. So, to keep a balance and to make things simple, our ancestors said, eat food of all colors. 7 colors food should be on your plate. Right? Simply because this gut is very important. And please do not forget, this gut is connected to your brain. There is a very strong gut and brain axis. If you are feeling anxiety, if you are feeling depression, if you are not able to sleep, and vice versa, start with your gut, you will heal your brain, calm your brain, and you will heal your gut. And I think that's the core and essence of health when we look at it from the functional medicine point of view.
So gut is your second brain.
Exactly, it's your second brain and it's something we should focus on.
You have shared so much knowledge. Now, just to cut it short, what will be your take-home message?
Stay away from guilt is my take-home message. Why? Because whatever you do, if you are happy, I think your body is a beautiful machine. It will find a way out of it.
Thank you, Dr. Preeti Nanda.
Thank you,
was
Dr.
really a very illuminating talk, and I'm sure all our viewers will really benefit from it.
Thank you very
much.
Sibia. Thank you very much.
Thank you to all of you.